Hi guys, my name's Glenn. I'm from Optimum at Ashfield. I'm just going to talk you through a little topic today that I see quite often in the gym here. Basically we're going to go through some hip hinge mechanics and basically a bending mechanics motion. So a lot of people tend to bend a lot with their knees as opposed to using our hips. In today's society we tend to see that most people are sitting down throughout the day for a long period of time. The gluteal muscles tend to get elongated, sort of floppy and inactive, and we tend to get tight through the hip flexors up the front here. So basically we tend to dominate through our quads, use a lot of knee bending. So basically if I was going down to touch the ground, a lot of people tend to just drop the knees forward like that, as opposed to keeping the weight on the heels, hips coming back like that, and actually keeping a neutral spine. So what we're going to walk through here is just a couple of ways to actually work on this movement and start to improve it a little bit. So first off, we basically want to be nice and straight through the hips, about a foot off the wall here. So I'm going to keep my weight on the heels like so. We're going to go hands across the chest like this. And then the reason I want some distance between me and the wall is that's actually going to train us to load up the heels, stick our bum back and not load up the knees like so. So just from a side-on motion here, basically we're trying to keep the shins very vertical here. We don't want to drop forward like so. We're loading up the heels. I'm sticking my bum back like that. So trying to look for what would be a wall behind me here and coming back up like that. So as opposed to a bad movement would be from here, just dropping the knees forward and then the hips tend to follow like that. That's not looking after our knees and it's not looking after our back. So by putting the weight on the heels, sticking your bum back, a little bit of tightness through the stomach, we're keeping what we call a neutral spine. So we're not putting any compression forces through the front of the spine, which is where your intervertebral discs are. So reducing your risk of basically a disc bulge or herniation and that sort of thing. So we might go on to a side-on view next up and then we'll see it in a bit more specifics. All right, so having a look at that movement from the side-on angle here, we want to be about a foot away from the wall like so. What I'm going to do, keep the weight on the heels, hands across the chest and sticking the bum out, searching for the wall like that. Once my bum touches the wall, I'm going to do what I term pre-engage the muscle. So we're going to squeeze the bum cheeks together and you're going to try and maintain that squeeze on the way up like so. If we're a little bit lazy and you just stick your bum out to touch the wall and then come back up, basically what can happen is the extensors of your lower back tend to kick in and do most of the work. But by pre-engaging the muscle, we're actually making sure there's tension there before we start the movement. So now the glutes are your prime mover and that's going to become more important once we're actually lifting something with weight. Every day coming up and down like that, probably going to get away with it, but once we start to lift something heavy, if the glutes aren't kicking in, your back takes all the strain and chances are you're going to go into what we call lumbar rounding, putting pressure on those discs. So the next progression here, we're going to actually add some resistance so that our glutes have to work a little bit harder. So just going to jump across here into what we call a power band. So just jumping in like this. This is something we get a lot of spinal rehab clients to go through, but also healthy populations as well, just to try and prevent injury as well as treat. So from the side-on angle there, we're going to walk out so there's actually some tension there. The band's going to assist me in that hip hinge movement, so the bum coming back, keeping the neutral spine. And then when I want to come up, I actually have to squeeze my glutes a little bit tighter because I'm trying to overcome that force. So I'm trying to push the hips forward like so, and then it's slow and controlled on the way back. So we're not overextending, we're not using the lower back muscles excessively, it's more of a stabilizer. The glutes are doing all the work here. So if we want to progress this even further, we would then grab some weights and basically hold them down by our knees and then start to load up from there. So that way we can take it all the way up to basically working up to 40, 50, 60 kilos. But because our glutes are doing all the work, we're looking after the back and we're keeping the back nice and safe. So yeah, that's basically an example of how you should be moving during a hip hinge movement. So things like bending down to tie up your shoelaces, bending down to pick up something heavy off the ground, looking after your spine health long term. So if that's something we're interested in, that's something that we train in depth at Optimum Health Solutions, and we can help you out with that when you come in to see us. So, thank you.